is Smith. I am Dr. Upagunjuri, and I heard that recently you have been diagnosed with idiopathic thrombocytopenic purpura, and I'm here to explain the potential consequences and how we can go about treating your condition. Before I begin, I recommend that you go to a hematologist, someone who specializes in blood disorders. This is because the hematologist can confirm your diagnosis and also see the severity of your ITP, and then we can proceed with your treatment accordingly. You might be wondering what caused you to get this disorder. Well, women are twice as likely to develop ITP than men, but the cause of it is unknown. But what happens with patients in the body is that your immune system destroys your platelets. The function of your immune system is to attack any organisms that are in the body that can cause the illness. But unfortunately, your immune system produces these antibodies that attach themselves to your platelets, and your spleen destroys these platelets. Platelets are these things that are important for normal blood clotting and also help stop bleeding. Since patients with ITP are low on platelets, we see bleeding for a long time. This is why when you cut yourself the other day at dinner, you bled for a long time. This leads to the potential consequences you might experience in the future with ITP. You might experience excessive bruising, bleeding into your skin that appears like a rash, like the red spots you saw, and prolonged bleeding from cuts, and also you can experience spontaneous bleeding from your nose or gums, and blood in urine or stools, and lastly, you can experience fatigue. That is why you feel tired and weak. Despite all these complications, there are treatments available for your condition. In fact, there are several options, but if your ITP condition is very mild, then treatment might not even be necessary. Regular monitoring of your platelet count is the only thing that is needed. If this is not the case, however, the first line of treatment is usually a corticosteroid. A corticosteroid works by decreasing the activity of your immune system, which increases your platelet count. Once your platelet count is back to a safe level, you can gradually stop taking corticosteroids. In general, this happens in about 2 to 6 weeks. But there are some problems that can arise from stopping this treatment. Many people experience a relapse after stopping corticosteroids. In case of relapse, another course of corticosteroids can be given, but the problem is that long-term use can increase the risk of severe side effects. These side effects include high blood sugar, weight gain, increased risk for infections, and also loss of calcium from your bones or osteoporosis. If you need to take corticosteroids for a long time, it might be recommended that you take supplements, calcium and vitamin D supplements, to help maintain your bone density. As you have already experienced, bleeding is the biggest consequence of ITP. If you ever experience severe widespread bleeding, it is necessary that you get emergency care. Severe bleeding can be very dangerous, and it demands help immediately. In such cases, you might have to receive intravenous immune globulin. Although intravenous immune globulin is quick and effective, it usually wears off in a couple weeks. In most severe cases, the removal of the spleen might be necessary. Since the spleen is what is destroying the platelets, it is the root cause in the body. If initial course of corticosteroids hasn't worked, the surgical process might be necessary. But there are some severe post-surgical complications that can occur, such as not having a spleen increases your vulnerability to infection forever. And also, if surgery is performed, it is important that you look out for signs of infection and seek prompt care if these symptoms appear. With these treatments, lifestyle changes can also improve your condition. Avoid platelet-impairing medications such as ibuprofen and aspirin, and also healthy eating and regular exercise are important, but avoid high-impact physical activities such as competitive sports, and also anything else that can increase your risk for injury and bleeding. And also, since there is a wide variety of your treatment, it's best that you and your doctor decide what is best for you. The severity of your condition and other complications you might have, and the risks of certain treatments can narrow down your treatment options. And lastly, it might be unfortunate that you have this condition, but don't let this control your life. There are some things that we can't stop, but don't let those things stop you. I hope this video helps, and continue being the phenomenal teacher you are.